Utah State CNA Practice Test. Question 1. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 2. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 3. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 4. What is the primary goal of restorative care? To perform all tasks for the resident, to help the resident regain or maintain the highest level of function, to cure the resident's illness, to move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function. Question 5. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 6. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 7. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes, every hour, every 2 hours, once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 8. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 9. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 10. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 11. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time? It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 12. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 13. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 14. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 15. Which of the following is a normal part of aging? Loss of all memory, slowed reflexes and reaction time, incontinence, constant pain. While some decline is normal, like slower reflexes, things like total memory loss or incontinence are not normal parts of aging. Question 16. What is the correct way to lift a heavy object? Bend at the waist and keep legs straight. Keep feet close together. Bend at the knees and use leg muscles. Lift with your back muscles. Proper body mechanics involve using the strong leg muscles and keeping the back straight to prevent injury. Question 17. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 18. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 19. What is the proper method for cleaning the perineal area of a female resident? From back to front, from front to back, in a circular motion, with a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 20. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts.